question before about women. There are a lot of issues where what the president is doing, talking about public safety, which is increasingly a concern for women as they see what is going on, but also policies that he's taken. So the president has done extraordinary things on healthcare. His executive order requiring price transparency, that is an issue that is 88% popular across the country, across party affiliations, across ideologies, across demographics. Among women who are 40 and under, it's a 98% approval issue. Without this president being reelected, that executive order goes away because Congress hasn't yet made it into a law, because it goes into effect in January of 2021. So this has historically been the #1, if not the top 3 issues in the country. And this is the only person who's going to bring price transparency, which can bring down healthcare costs by 40%, revealing what the true prices are of your hospital or your insurance before you have to pay for it, so you can shop, or other people will shop, and that will drive down prices. Enormous issue for this cohort. So women care about a lot of things.
So nice that you say that, because they don't speak about it, but transparency is a very controversial issue because doctors don't like it, and frankly, hospitals don't. The good doctors love it, and the good hospitals love it.
Doctors and patients love it. Hospitals, insurers, PBMs, which are the wholesalers that control the pharmacies.
That's right.
And pharma, they all have lobbyists all over Washington trying to stop what the president is doing.
I've had many people that are really expert at it. They say it's a bigger issue than healthcare itself. It'll save so much money, and it's the full deal. I signed it. It's done. It goes into effect on January 1st. And you're right. If the Democrats get in, they'll probably try and end it. And what a shame that would be, because it was so hard to get it done, and it will save people massive amounts of money. I'm not talking about 1% or 2%. The other thing we just did, you probably heard, is I signed a favored nations clause on drugs, because we have countries in the world, Germany and others, but we have many countries in the world that pay a tiny fraction. I don't mean like 2% less, 10% versus what we pay. You have a pill that will sell for 10 cents in a certain country in Europe that will sell for $2.50 in this country, and it's so unfair to our people. And I signed a favored nations clause, and the drug companies are spending millions and millions of dollars trying to get me not elected. And all it means when you see ads from drug companies, all it means is one thing: the drug prices are going to be coming down 50, 60, 70%, and they never thought anybody would do that. I also signed a rebate clause, so the rebate money, instead of going to the middlemen, who among the richest men in this country, and men and women, I guess, in this country by far, the middleman. The middleman makes more money than the people that produce. At least the drug companies produce something. But I signed where the rebate goes to the people. There's never been anything like this. And as a non-politician, I could do it. And I will tell you, I was called by a lot of politicians that I was surprised at, literally begging me not to do it. Please don't do it. Please don't do it. And because, you know, the Big Pharma is by far the #1 lobbyist paying group in the country, and people are loyal to Big Pharma, and I'm all for Big Pharma, but this is a tremendous, this will be a tremendous drop. So between transparency and what I just did with respect to favored nations, that means if Germany pays 10 cents and we're paying $2.50, we go down to 10 cents. That's a number that nobody's even thought of. And what will happen is they'll have to pay more, and we're going to have to pay much, much less. Like numbers, and it could be 70, 80%. So we're not talking about games. And nobody had the courage to sign it. A lot of people didn't even know about it. A lot of people. So I appreciate very much you saying. And it may be that transparency is even more important than that.
I think it is, because transparency is the basis for markets, and that's the basis also for trust. Right now, you don't have the right to know what something costs before you buy it. If airlines followed the same model as hospitals and insurers do, you wouldn't know the price of your airline ticket until after you landed, because they don't know how full the flight's going to be. They don't know how much gas they're going to have, fuel they're going to have to spend. So, but every other business manages to do their average pricing. Hospitals know their average prices. That's how they sell so quickly when somebody's buying a hospital. Right. They're just not sharing it.
It's so great. It's so great. Let's see, voters. Well, that's interesting. See,
you're
just.
Jimmy,
no, this is very.
Fun of this again?
No, but can I tell you that? No, I think it's great that we're talking about something that you know a lot about, And it does pretend,